The Mental Health and Recovery Service Board of Seneca, Sandusky, and Wyandotte County. We are conducting our board meeting via webinar on Thursday, April 16, 2020. Beginning time is 7:06 p.m. And the first motion that we are going to read tonight is to present the February 27, 2020 board meeting minutes. That is the last meeting we had face-to-face here at the board office. Robbie, will you please go and read that motion?
To approve the February 27th, 2020 minutes of the Mental Health and Recovery Services Board of Seneca, Sandusky, and Wyandotte Counties.
Can we have a first to approve the motion?
I make a motion to approve it. Dean.
So Dean was the first, and did we have a second?
Me.
I'll
Pam.
second.
Oh, Pam, okay.
Pamela.
All right, now we're going to go through the roll call for that then.
Let's open any discussions first, Nicole.
Oh, okay, sorry, go ahead.
Any discussions? Comments? Go ahead with the roll call.
All right. Okay, Dean,
Yes.
Pat,
Yes.
Marcus,
Yes.
I think we might have lost D. I'm trying to find hers. Okay, I'm gonna, and D, if you're on, you can unmute yourself.
Okay, yes.
Okay, perfect. Thank you. I couldn't find your thing. Thank you very much.
Well,
Pamela? Tony? Is Tony there? Oh, Tony? All right, I guess we're not hearing Tony. Luke?
Yes.
Thank you. Celinda?
Yes.
Karen? Karen? Ruth?
yes.
Thank you. All right, we didn't hear from Karen.
Yes.
Oh, thank you, Karen. All right.
Motion passed. We will have Tony as a question mark because we didn't hear him. We are going to move to the second, actually third item on your agenda, which is the Lotus Recovery House policies. Our hope was prior to COVID-19 for us to have these motions approved and submit them as soon as possible to Ohio Recovery Housing so they can come to our community and do a site visit for the Lotus Recovery House. These policies are in the final draft. They were reviewed by the Lotus Recovery House Advisory Committee. They were also listed on our website, and they are still listed on our website as a draft. And I believe probably over a month ago, we send these policies to all of you guys for a final review. If you guys have any questions about them, you can go ahead and unmute yourself and speak now. If not, I'll probably have Robin read the next motion.
This is Robin. I just want to add that I did make two changes, slight ones. The first one was on the admission and discharge policies. I changed the word admission to move in and discharge to move out. And the reason is admission and discharge are really more related to treatment, and move in and move out are housing terms. So Ohio Recovery Housing had encouraged us to make that change. And then under the emergency policy, I just added a section that indicated Lotus Recovery House will follow local, state, national recommendations during emergencies and pandemics.
Robin, go and read the motion, and after the second, we can reopen it for discussions or questions.
To authorize the executive director to implement the following policies and procedures related to Lotus Recovery House effective April 17, 2020. Move-in process, resident house rules, resident rights, lease and rent policy, confidentiality policy, emergency policy, grievance policy, reportable incident policy, medication policy, alcohol and drug testing policy, recovery support and relapse prevention policy, visitor policy, good neighbor policy, volunteer policy, communicable disease infection control policy, and move out policy.
This is Dee. I second the motion.
I'll go ahead and make the motion.
Thank you, Pat. Thank you, Dee. Any questions or discussions? I do want to remind you again, these policies, even after approved, will continue to be posted on our website. Nicole, please go ahead with the roll call.
Dean,
Yes.
Pat,
Yes.
Marcus,
Yes.
Dee,
Yes.
Pamela,
Yes.
Tony. I see he's on here 3 times. I was hoping maybe he got it. All right, we'll keep going. Luke,
Yes.
Celinda,
Yes.
Karen,
Yes.
Ruth.
Yes.
All right.
Thank you. Motion passed. The fourth item on agenda, it's a recommended contract amendment for fiscal year 2020 with Violence Counseling and Recovery Services. At the beginning of March, we had a site visit from Ohio Department of Mental Health and Addiction Services regarding the criminal justice linkage grant. Actually, they are now allocations. I'm sorry. And our board was offered an additional $66,000 for the remaining of this year for services provided by Firelands in the 3 county jails. Based on the current utilization, I had a discussion with Robin and Tanya, and we went ahead and accepted the funds from Ohio Department of Mental Health and Addiction Services. However, in order for us to encumber these funds and be able to issue payment to Firelands, we will need to amend their current contract. Any questions or discussions about these funds? And I believe we already received $66,000 but I can quickly check. No, we didn't yet. Any questions? Okay, Robin, would you go and read the motion, please?
To authorize the executive director to amend the fiscal year 2020 contract with Firelands Counseling and Recovery Services by increasing the contracted amount by $66,000 from $2,435,294.56 to $2,501,294.56 for the Criminal Justice Innovations BHCJ linkage allocation funds contingent upon availability of funds.
I make the motion. This is Karen.
Thank you, Karen.
I'll second. It's Celinda.
Thanks, Celinda.
Any discussions? I believe this is the second or third year in a row where the State Department is offering us additional funds close to the end of the fiscal year. Nicole, please go ahead with the roll call.
Dean?
Yes.
Pat?
Yes.
Marcus?
Yes.
Whoops. What? D?
Yes.
Pamela? Oh. Can I ask someone to Ooh. I don't know what that was. Sorry, guys. Oh, maybe Marcus. That's okay, Marcus. Pamela?
Yes.
Tony? Luke?
Yes.
Celinda?
Yes.
Karen?
Yes.
Ruth? Oh. Sorry, Ruth. We're both pushing the button. Go ahead.
I won't push anymore.
Is yours a yes, though?
Yes, sorry.
That's okay. Thank you. All right.
Motion passed. The next item of agenda is a recommended contract amendment with the Sandusky County Clyde Court for ATP funds, which are Addiction Treatment Program funds from Ohio Department of Mental Health and Addiction Services. These funds were given to us in fiscal year 19 as well as fiscal year 2020. We actually had a carryover balance from 19 to 20 in an amount of $46,831.42 that were approved as carryover from the state. The state awarded us $25,000 for fiscal year 2020. The beginning of March, again, we were informed that the department would like to give us additional $55,000 specific to ADP services. However, those funds can be used and split between Clyde Court and the Seneca County Courts. For the Sandusky County portion, the Clyde Court utilized the funds for Firelands Counseling and Recovery Services, Sandusky County Task, and Corporate Anointing Ministries to provide recovery housing. As you guys know, our board terminated our contract and any collaboration with CAM the end of 2019. However, CAM continues to provide services to Sandusky County Clyde Court. The court has contacted us and asked for payment in amount of $3,198.80 to cover recovery housing costs for some of the court clients. I had discussions with Judge Kolosar, and they are in agreement for them to pay that amount and them to be the pass-through agency. In addition, we talked about expanding some of the services to the clients and to approve transportation costs as well as purchase some materials for education materials for the core clients. We have recommended an amendment to increase the contract amount by $8,664.94. This will be again an amendment with the courts. We will pay the courts, and then the courts will pay CAM as well as transportation costs and education materials. These funds will all be taken out of the fiscal year 2019 carryover amount.
Real quick, can I just ask whoever had just called in to just mute their line, please?
Hello?
Hi, can I just ask you to mute your line, please? Sorry. And who is, can I ask who it is too?
This is Tony, and I'm on my phone now. It's not on FaceTime, though. I don't know how to mute it otherwise.
Okay, no problem. We'll just try to limit the feedback. Thanks, Tony.
Okay.
Any questions about ATP funds in the summary I provided?
This is Celinda. I had a question. So I guess I'm just a little bit confused as to why we would go ahead and pass through that money if it's going to an agency that we don't approve.
The money were actually approved by the state legislators for the courts, and we are currently used as a pass-through ourselves to the courts. We are asked to work as a fiscal agent. Because of that, we are hosting the contracts with Farlands and Task, and used to have the contract with CAM, but because of our program reviews and concern, we no longer have a contract with them. In reality, we are unable to utilize these funds without the judge's approval.
Okay.
So if it is for us not to approve the amendment, let's just say that can happen. Therefore, the funds will be frozen. And most likely at the end of June, we'll have to send them back to the State Department.
Okay. So us approving those funds isn't really saying we approve of the court's choice to use CAM. It's just saying we're funding the court.
That's correct.
Okay.
And I'm not sure for how long will the courts use that agency. They could use them from here on, or maybe their verbal or written agreement was through the end of this fiscal year. Any other questions? Okay. Robin, would you please read the motion?
To authorize the executive director to amend the fiscal year 2020 contract with Sandusky County Clyde Court by increasing the contracted amount by $8,664.94 from $54,659.01 to $63,323.95 for the addiction treatment program.
Ruth Watson, I'll make a motion for that.
I'll second it. This is Karen.
Any other discussions? Nicole, go ahead with the roll call, please.
Dean?
Yes.
Pat?
Yes.
Marcus?
Yes. Yes.
Dee?
Yes.
Pam?
Yes.
Tony?
Yes.
Luke?
Yes.
Celinda?
Yes.
Karen?
Yes.
Ruth?
Didn't touch it. Yes.
Thank you.
Okay, motion passed. Thank you. Next item on agenda. Actually, I didn't include this on agenda, but I wanted to quickly talk about the board strategic plan. I want to thank Linda and Karen and Robin for spending some time for us to create pretty close to a final draft of the board strategic plan. I did have discussions, I believe, with both Linda and Karen in the last few weeks, and it was recommended for us to not approve the strategic plan yet. I believe this COVID-19 pandemic could maybe change our priorities in upcoming years, and would like to delay the process for a little bit. I have no motion to recommend here. I believe the strategic plan was also sent to you around a month ago. I can resend it out. The goal was for us to probably reconvene when we can get back together face to face and look at any changes again related to the COVID-19 pandemic that we might want to consider. Next item on agenda number 6 is fiscal year 2021 levy set-aside funds. And I want to remind everybody, these are usually the levy funds that we approve first every year. These are funds that we put aside, non-competitive, for us to be able to pay some dues or conduct community health assessments in each of the 3 counties, as well as some of these funds going to be used for each county auditor for their fees of processing our levy amounts, as well as board administration expenditures. We are keeping 10% for board admin expenditures from each county. Everything else, all the other funds that are fiscal year 2021 levy, we will probably review them at the next meeting. I will make some comments about that later throughout the meeting. I know this will require 6 motions, but we can, if you guys have any questions, go ahead and please ask now prior to Robbie reading the motion.
This is Pam. I had a question from a newspaper article that 3 of the Seneca County offices are asked to take a $2 million reduction. And I was wondering, can we really plan the 2021 fiscal budget if we haven't been hit yet for a $2 million hit?
The levy funds that we are collecting are not affected by any cuts made by county commissioners in any of the 3 counties. These levy funds are property taxes that we are collecting specific to our organization. So the $2 million cuts or again, any cuts in a county budget will not affect these funds. The remaining of the levy allocations that we will approve at a later date, we will probably delay until we see how our state and federal budgets going to be affected. I believe, and I can talk about it now, but I believe we will see a reduction in state and federal allocations, which will probably force us to allocate less levy funds to some agencies so we can keep our essential and critical services at the same level as we have them today. I also had discussions with Dean, which is our administrative chairperson, and Karen, which is our board chairperson, and we created a draft fiscal resolution to monitor this impact. There was also emailed to all of you guys yesterday, and it will be later on the agenda as a new business. So I will have more feedback about the financial implications later throughout the meeting.
Thank you.
So Linda, I saw your hand thing was up. Was it up from last time, or did you have another question?
I think it was up from last time. Sorry about that.
Nope, no problem. Just wanted to make sure. Thanks.
Any questions? Okay, please bear with us. We have 6 motions going in a row here. Robbie, please go ahead and read the first one.
To authorize the executive director to set aside $40,000 out of Seneca County fiscal year 2021 levy funds for dues, assessments, and county auditors' fees. Do you want me to read each one right now?
We will need the first and the second for each one of them in a roll call.
I'll make the
I'll
motion.
make the motion.
Was there Luke, I believe, first, and who was second?
It was Pat, I think.
It was Karen. I'll
Second.
second it.
Pat and Karen?
Yes.
Please go ahead with the roll call, Nicole.
All right. Dean,
Yes.
Pat,
Yes.
Marcus,
Yes.
Dee,
Yes.
Pamela,
Yes.
Tony,
Yes.
Luke,
Yes.
Celinda,
Yes.
Karen,
Yes.
Ruth.
Yes.
Thank you.
Motion passed. Thank you. Robin, can you please read motion number 6?
To authorize the executive director to set aside $85,000 out of Seneca County fiscal year 2021 levy funds for board administration expenditures.
Ruth Selecton, I'll make a motion.
I'll second.
Who was that seconded? I'm sorry.
I said I would second.
Marcus.
Marcus.
Okay. Nicole, please go with the roll call.
Dean,
Yes.
Pat,
Yes.
Marcus,
Yes.
Dee,
Yes.
Pam,
Yes.
Tony,
Yes.
Luke,
Yes.
Celinda,
Yes.
Karen,
Yes.
and Ruth.
Yes.
Thank you.
Thank you. Motion passed. Robin, would you please read the next motion?
To authorize the executive director to set aside $40,000 out of Sandusky County fiscal year 2021 levy funds for dues, assessments, and county auditor fees.
I'll motion.
Ruth Boston, second.
Marcus and Ruth.
Yes. Roll call, please.
Dean,
Yes.
Pat,
Yes.
Marcus,
Yes.
D,
Yes.
Pamela,
Yes.
Tony,
Yes.
Luke,
Yes.
Celinda,
Yes.
Karen,
Yes, and my volume seems to go way down. Is that me or everyone?
I'm not sure. I don't think anyone's changed anything on this end.
Okay, thanks. It must be me.
No problem. Ruth,
Yes.
thank you.
Motion passed. Thank you. Robbie, next motion.
To authorize the executive director to set aside $85,000 out of Sandusky County fiscal year 2021 levy funds for board administration expenditures.
I'll make that motion, Mrs. Dean.
I'll second.
Dean and Marcus, roll call, please.
Dean,
Yes.
Pat,
Yes.
Marcus,
Definitely yes.
D,
Yes.
Pamela,
Yes.
Tony,
Yes.
Luke,
Yes.
Celinda,
Yes.
Karen,
Yes.
Ruth,
Yes.
Motion passed. Thank you. Robin, can you go with the next one?
To authorize the executive director to set aside $19,600 out of Wyandotte County fiscal year 2021 levy funds for dues, assessments, and county auditor fees.
I'll make the motion. This is Karen.
Luke will second.
Roll call, please.
Dean,
Yes.
Pat,
Yes.
Marcus,
Yes.
D,
Yes.
Pamela,
Yes.
Tony,
Yes.
Luke,
Yes.
Celinda,
Yes.
Karen,
Yes.
and Ruth.
Yes.
Motion passed. Thank you. Next motion, please, Robin.
To authorize the executive director to set aside $33,934 out of Wyandotte County fiscal year 2021 levy funds for board administration expenditures.
Ruth Watson, make a motion.
I'll second.
Roll call.
Dean,
Yes.
Pat,
Yes.
Marcus,
Nicole, I think you are muted.
sorry, Marcus,
Yes.
D,
Yes.
Pam,
Yes.
Tony,
Yes.
Luke,
Yes.
Celinda,
Yes.
Karen,
Yes.
and Ruth.
Yes.
Thank you, everybody.
Motion passed. Thank you. Okay. We can, on our agenda, next we have general updates, but I would like to leave those for the end. We can go into the new business. And again, the reason I call it new business is because it wasn't included in the notes I sent you a week ago. This is the fiscal resolution that was sent to you yesterday. Again, it's something that we had discussions with the administrative chairperson and the board chairperson about. And I can give you a little update before Robin reads the entire resolution. We were informed that there could be obviously cuts from the State Department. Ohio governor approximately 2 weeks ago asked all state departments to look at approximately 20% cuts in their budgets, which we believe some of it will probably trickle down to us as a board. We did not receive any projections for fiscal year 2021. Just to give you an idea, usually March or April, we are receiving 2021 or the next fiscal year budget. We didn't receive, again, any numbers yet. We probably will not receive it for a few weeks.
You can go.
We are planning to propose to delay all levy contracts until we have a better understanding on how our state and federal funds are going to look like. In the resolution, you're going to see that we put language regarding freezing all of our administrative costs. That includes salaries, benefits, travel, supplies, equipment. We did put in a resolution for us to freeze any capital projects unless they are grant funded at least 75%. We also put information about really prioritizing into the next fiscal year essential services. And what we call essential in the resolution was really the crisis and medications, hospitalizations, therapy, really the core behavioral health services that are listed in Ohio Revised Code 340 and 5119. Just as an idea, again, I don't want to project too much because, again, we don't have any numbers. But if any cuts are to come down to the boards, obviously, local boards will have to make some decisions about where we're gonna have to cut some of the services. When we look at our board, I think we are in a healthy financial situation with our reserves. We do have the option to try to maintain all the contracts flats and use some of our reserves, or we can split the difference between using some of the reserves and again, maybe cutting some of the contracts, especially the non-critical service.
Oh my gosh, I just lost internet. I just lost internet. Yeah, that was Zoom. I don't know.
Similar things to reduce some of their costs in the budgets, various departments, or to freeze some of their current expenses for the remaining of this calendar year. Our resolution is for 12 months, not through December 31st. So our resolution reads through, I believe, April 16 of 2021. I would like to open it for discussions. We can open it again after Robin reads the resolution as well. Any questions? Did anybody didn't receive the resolution?
Pam, if we make a budget, can we amend it once we find out who's taking what away from us.
Correct.
Would that be a safer way to go?
Well, right now we are not really making any cuts. What we are saying through this resolution is we are freezing everything at the current levels. And really, we are looking more at the administrative costs. What does it take to run this board versus looking at the providers? When it comes to providers, what we are freezing is the non-essential services. We are recommending for them to stay at the same level. And we are recommending, again, not to take on any capital project similar to Lotus Recovery House unless they are at least 75% grant funded.
Okay.
I just want to remind you guys, every contract after June 30th. So all of our contracts right now, except a few calendar year contracts, but most of them, I would say 95%, going to end June 30th of this year. All of those contracts, they're going to begin July 1, will be approved through a motion. So as soon as we will get some numbers from the state level, I will draft an entire budget for you guys to see. And really, every contract on that budget will also be approved in an individual motion.
Okay.
Again, if we get some cuts, we do have the possibility to still, I believe, keep our contracts at the same level as today if we dip into some of our reserves. And I think we're in a situation that we can, again, based on how large the cut will be.
Thank you.
One more item. This resolution that we are planning to pass tonight, let's assume that things are not as bad as the governor is telling us today. Let's just assume. This resolution could be amended by a majority vote.
Okay. Good. Thank you.
No problem. This resolution will be on our website probably tomorrow sometime, as well as all the motions. I know there are some of the people from the public on the line. So all these motions plus the resolution will be on our website sometimes tomorrow, if not even tonight. Any other questions? Robin, would you please read the resolution? I know it's long, but would you please read the entire resolution?
Resolution responding to COVID-19 pandemic and its financial implications. Whereas on March 19, 2020, Governor Mike DeWine declared a state of emergency in Ohio due to the COVID-19 pandemic. And whereas on March 14, 2020, Department of Health Director Amy Acton issued an order to close all K-12 schools in the state of Ohio due to the COVID-19 pandemic. And whereas on March 15, 2020, Department of Health Director Amy Acton issued an order to restrict food and beverage sales to carry out and delivery only due to the COVID-19 pandemic. And whereas on March 16, 2020, Department of Health Director Amy Acton issued an order to close polling locations in the state of Ohio due to the COVID-19 pandemic. And whereas on March 22nd, 2020, Department of Health Director Amy Acton issued an order that all persons stay at home unless engaged in essential work due to the COVID-19 pandemic. And whereas on March 23rd, 2020, Governor Mike DeWine asked state departments for a 20% budget cut due to the state revenue decline related to the COVID-19 pandemic. And whereas on March 23rd, 2020, Governor Mike DeWine ordered a hiring freeze on state government positions, except for those that are necessary to combat the COVID-19 pandemic. And whereas on April 9th, 2020, Ohio Department of Job and Family Services reported 696,519 new jobless claims filed in Ohio since March 16, 2020, mostly related to the COVID-19 pandemic. And whereas on April 9th, 2020, the Ohio Department of Job and Family Services reported distribution of over $124 million in unemployment compensation payments to more than 195,000 claimants since March 16, 2020, mostly related to COVID-19 pandemic. And whereas the Mental Health and Recovery Services Board of Seneca, Sandusky, and Wyandotte counties is a political subdivision, not a state agency nor a county department. However, the Mental Health and Recovery Services Board relies on state and federal allocations as well as local levy funds collected from property taxes. And whereas the Mental Health and Recovery Services Board of Seneca, Sandusky, and Wyandotte counties acknowledges that federal, state, and local budget cuts are financially concerning and could have a direct impact on the resources earmarked for behavioral health services in the board district. And whereas the Mental Health and Recovery Services Board of Seneca, Sandusky, and Wyandotte counties is committed to ensure to the best of the board's planning capabilities that any budget reduction will not affect essential prevention, treatment, and recovery support services as defined in Ohio Revised Code 340 and 5119, and therefore be it resolved that the members of the Mental Health and Recovery Services Board of Seneca, Sandusky, and Wyandotte counties are taking the following actions to conserve funds for the most essential and needed behavioral health services through April 16, 2021. 1, restrict all new board hires except in the case of a vacancy. 2, restrict any board employee promotion except in the case of a vacancy. 3, restrict any board employee salary increase. 4, restrict all capital projects unless the capital project is at least 75% grant funded. 5, restrict administrative costs, including equipment, supplies, and travel and expenses at the approved calendar year 2020 amounts. 6, restrict any levy contract for current providers at the fiscal year 2020 levels or less, except A, for essential behavioral health treatment services such as crisis, hospitalization, medication, and outpatient individual and group therapy, and B, for in-school behavioral health services as planned with the fiscal year 2021 RFIs. And 7, limit any new levy services to essential treatment and recovery supports, such as crisis, hospitalization, medication, outpatient individual and group therapy, mental health housing, and recovery housing. Throughout the next 12-month period, the Mental Health and Recovery Services Board will closely monitor its financial abilities as well as community behavioral health needs and opportunities in order to adequately plan for a sound and sustainable behavioral health system in Seneca, Sandusky, and Wyandotte counties. Ratified on the 16th day of April, 2020.
Can I have a motion to approve the resolution?
Bruce Watson, I'll make the motion.
I'll second.
Any discussions?
Mayor, this is Karen. I just want to know that if there is something that changes over the next 12 months, will there be an ability to change this resolution at all?
I'm going to have to unmute.
Yes.
I have to unmute in a second.
By a majority vote, we will be able to amend the resolution.
Okay, that just answers what I needed to know. Thank you.
And throughout the remaining of this calendar year, you guys will probably receive from me regular financial updates, probably more than what you want to hear, but I will continue to keep you up to date on where we are. As of today, again, prior to reading the roll call, again, I want you guys to know we are, what I believe we are positioned in a healthy financial situation, and hopefully we can sustain our local behavioral health system, again, at least at the same levels as the current year. I think the decisions that we made together in the last 5 to 7 years put us today in a situation that even if this pandemic looks really devastating to many organizations financially, I think we will be able, at least the critical services, to keep them at the same level moving in the future.
Once we're done with this, you can go, because I'll be done doing roll call.
Nicole, please read roll call.
Dean?
Yes.
Pat?
Yes.
Marcus? Marcus?
Yes.
D?
Yes.
Pam?
Yes.
Tony?
Yes.
Luke?
Yes.
Celinda?
Yes.
Karen?
Yes.
Ruth?
Yes.
Motion pass. Thank you. We are at general updates. Approximately a week ago, I believe all of you guys received the email from Ohio Auditor of State. They started our calendar year 2019 fiscal audit.
No, but... Oh, I'm sorry. I didn't realize I didn't remute. Sorry.
You guys might receive emails from them or maybe even phone calls. This is usually a 3 to 5 month process. I did respond today with some additional information, but again, I just wanted to let you know this is the state auditor conducting a fiscal audit for calendar year 2019. Second update I have is I just want to give you a summary how this COVID-19 pandemic has impacted our local behavioral health system. Really, as soon as the shutdown, I guess, of our state started, we quickly tried to implement with our behavioral health agencies teleconference or telemedicine for some of our clients. Farlands, Oriana House are conducting such services through telehealth. Medicaid actually also approved reimbursement for these services approximately 2-3 weeks ago. We are working with Farlands now to look of implementation of a updated hotline, not hotline, but telehealth service. Same with Oriana House. So our 2 largest providers are looking at some software program. They will position themselves in a better situation to continue to serve our clients. They continue to provide some face-to-face services. They continue to provide some small groups where they try to obviously make sure there's social distancing. You might heard this across the state. Our agencies, I think, are managing to the best of their capabilities. Oriana House did furlough a few of some of their employees this week. A therapist from Fremont and a therapist from Tiffin in Norwalk. I know Farlands had a directors meeting today to look at some of their staff and if they have to make any changes. I didn't talk with them today, but I did talk with them yesterday. I think we are very fortunate to have a large provider like Farlands to be able to help us maintain the behavioral health system. I will tell you in some other communities across the state, I think the implications are way more severe than what we experience in our 3 counties. Very grateful for that. We are looking to make some flexible changes to Farlands and Oriana House contracts. Right now, we are not looking at any new money, but we are looking at some flexibility with some of the state and federal funds to cover some of the costs related to telehealth or any new software programs. I'm actually on a meeting, on a conference call tomorrow with the state. We are looking with the state and our association to see what kind of flexibility we can get from the current state allocations that we receive or federal grants. Actually, at 4 o'clock today, we were on a conference call with Senator Corman, and he's urging some flexibility for our SOAR federal funds starting next fiscal year, but not yet for the current year. But we do have a conference call about that on Friday. We did internally for our office, we did obviously had to adjust everybody's schedule. We are trying not to overload the office with all the employees at the same time, so we are kind of rotating the office hours versus working from home. At the moment, for example, Robin and myself are at the office, but we try not to have more than 2 employees at the same time at the office. Some employees come evenings or weekends, and I did allow some of them to work from home. I want to let you know that Fallens implemented a 24/7 support line for healthcare providers and first responders. This is a new service, again, related to COVID-19, 24/7 support line for healthcare providers and first responders. It's a different number than our current hotline. So again, it's a different number. We do have the number on our website, on our social media. We have promoted the number into all the local newspapers. It is 419-557-5835. If you need more information, please let me know. Out of the regional funds, we received some regional funds from Lucas County. We talked with Alicia Nelson from Recovery Ohio, and she allowed us to use some of those funds for an emergency COVID-19 related expenses. And I want you guys to know that we issued a $2,000 payment to Sandusky County Emergency Shelter Community Fortress at the beginning of this pandemic, that they were actually open 24/7 and serve some of our clients. They were trying to manage the homeless population in Sandusky County. Again, we had some of our clients that were didn't have housing or couldn't find housing. And again, I want to thank them for what they did. When everything was shut down, these individuals didn't really have a place to go. Prior to the pandemic, they were just working as an emergency shelter. It was open from 7 p.m. until 7 a.m. for approximately those times. Right now, during the pandemic, they are open 24/7 to serve the need. I also want to let you know that through the regional funds, we are planning to purchase some PPEs. We actually received, I went yesterday to Finley and pick up some soap, hand soap and gloves, and we have a few masks on the way, and we're planning to order some more. Our goal is to make sure, number one goal is that we have the right PPEs to our residential settings. So all the mental health group homes and recovery houses that we contract or manage, we want to make sure they have the supplies they need. And then the second priority is make sure we help all of our outpatient offices. They continue to see clients face to face. Today, I distribute some soap to the recovery homes and group homes, to Lotus Recovery House, and I know tomorrow I believe Fallens is coming to pick up some hand soap for their outpatient offices. We don't have a lot, but we have some, and we try to get it out to the community. This was a really effort among a few boards in our association in NAMI, Ohio. If you have any questions, let me know, but we are hoping to get more, and more is on the way. We had a few conference calls with our local providers. I believe 2 or 3 conference calls with all the providers together. Now I'm planning to stay in touch with them, all of them one-on-one. We did allow some flexibility for the providers. They were providing in-school counseling services. We had discussions with the superintendents, and again, made some exceptions there for the therapists to contact the families and the children through a phone or an internet to continue to stay in touch with their clients. I know Rabin has a few updates about the recovery house, as well as the housing update in general in our district, as well as CPT updates. CPT has to do with the individuals who are being released from prison into our community. If you recall, she was providing some updates prior to this pandemic. And as you probably know, quite a lot of individuals from the prisons were released back in the community, and Rabin worked really hard to make sure they have the housing and they are linked with the necessary services. Rabin, please go ahead with your updates.
Okay. So I've had the responsibility during this time to provide support for the housing programs that we contract for in SSW. We have participated in weekly calls and webinars with Ohio MOS and Ohio Recovery Housing on how to best support the residents in our homes during this time. First, I'd like to give you an update on the Lotus Recovery House. While we had every resident at a point of having gainful employment and or meaningful activity prior to COVID-19, almost all the women lost their employment, which hopefully is just temporarily at this time. But we were able to sustain the loss of the revenue from their rent through the state opiate response or SOAR grants. That was effective for us March 23rd for up to 3 months. And we were able to do that because the Lotus House was already a project under that grant. And they extended the use to allow to cover for rent because so many of the residents throughout Ohio were losing their employment. The residents are educated on a regular basis on COVID-19 issues and precautions. The house manager provides more supports remotely than she did prior to the pandemic, but she does go to the house when needed. There's been some generous donations to the residents through a Little Faith Ministries who receive donations from their church members or the Tiffin Paper Company or the food bank. The residents do participate in recovery supports via virtual avenues. Unfortunately, they respond and enjoy that face-to-face recovery supports, but they're just not able to participate that way. And so they have the technology at the home to do that. And then Firelands Counseling and Recovery Services began providing a recovery group twice a week for the women at the Tiffin office. The women did send a card to express their appreciation to the board for your support during this time. I also outreach to our mental health group homes in the board district. The Buckeye Rest Home located in Clyde reported that they're fine and they'll contact us if they need us. Firelands continues to monitor any residents that we have in that home on an individual basis. And then Mircha and I have regular contact with the New Housing Ohio staff. They operate the 2 mental health homes and the male recovery home and the homeless shelter here in Tiffin. They mostly have the supplies they need to operate, and they have protocols in place to address the pandemic. They've also made room at the recovery house for other male residents from the homeless shelter and the 8-hour mental health group home to reside there should they need to isolate residents. They also arranged for the 3rd floor of the homeless shelter to be utilized for isolation needs. They're offering these beds for other SSW residents with behavioral health needs who may need to isolate, but we ask that people go through us to help make that coordination. And like Mircha said, I'd also like to give you an update on the Community Transition Program, or the CTP program. This program allowed us to allocate funds to Rigel Recovery Services and Firelands to provide that treatment and supports to those persons with behavioral health needs that were leaving the prison. And as you know, the governor has ordered the early release of some low-risk inmates due to the virus. So in the past 2 weeks, SSW has experienced early releases of at least 4 inmates that we're aware of. Usually we have about a month's notice to plan for the release and get the services arranged. But these past 2 weeks, 2 of the cases were identified in the community before the prison system had a chance to be in touch with us to coordinate for services. In one case, we received the notice the day the person was released. But we've been able to manage the cases to date, and I do want to thank the two agencies, Firelands and Rigel, as they have responded quickly to help these persons get services.
Nicole, would you please provide an update regarding K-12 prevention and general updates regarding services with the schools?
I sure will, and I apologize in advance if you hear my son in the background. He's getting sleepy. Okay, so for the K-12 prevention initiative, I was just on a call the other day because a lot of it seems a little uncertain. Just, schools aren't in session right now, but they're still going ahead with kind of how it was planned, although there will be an extension. Originally, schools were going to be asked to do an implementation report this July, and they're now going to extend that until December of 2020, and then a final report in June of 2021. As of right now, out of our 12 school districts, or 16, school districts that we have 12 of them who have said that they're going to participate. And out of those 12, I think we have 11 schools that have submitted their assessment, their self-assessment of what kind of prevention they're already doing in their schools. And the state is just asking that they have those done by the end of June. So we only have a few more that we're waiting on for that. And then we'll take their plans. They're going to have plan of actions, and we will review those with a team of some of the prevention specialists in the 3 counties to be able to approve those. So that's kind of K-12 prevention in a nutshell. They'll still receive those funds, just a little bit different timeline, and it's looking just a little bit different for each school, just because they're not in session right now. Also, just an update on the school levy front, we have started to receive applications in for those as well. So I've been in contact with schools for both of those. And then Mircha also asked me to just kind of update you on prevention and education initiatives during this time. We've definitely ramped up our social media presence. And of course, my cat didn't bother me the whole time, and now it's over here. And we've also started to place a few ads in, I think we got an ad in every single paper that's in all 3 of our counties, and that should have been running sometime this week. We also had some resources printed out through the North Central Ohio Educational Service Center. They had a Serve the Community Resiliency Grant where they distributed paper products and foods to different households. This was last week here in Tiffin. They did it at the Seneca County Fairgrounds, and we were able to get out. They provided about 200 families in need their resources, and we had resources included in all of those.
Thank you, Nicole. Any questions about any of the general updates or any other comments or discussion you guys would like to have? I do want to remind all of you that the minutes from this meeting will be audio. However, Rose will keep track of the agenda and the timeline. So if you guys just want to listen or review only one item of the agenda, you can easily go back to that. We are going to use electronic signatures for the resolution in the minutes. Regarding the next board meeting, I would like to see what happens after May 1st before we decide. We definitely have to have at least one meeting in May. We might try to call another webinar at the beginning of May. I will consult with our chairperson and let you know. But if we're going to do another webinar, it will be the same setup as tonight. Any questions? Any comments?
I think we're working out the kinks. We're doing all right.
I want to say that I'm very impressed at how loud Robin is.
If we are, so Linda asked a question, if we will hold committee meeting in May. We will like to hold committee meetings in May, yes. I would like to see what the governor will decide beginning May 1st. And then we might have to hold committee meetings via webinar. I do think that if we can't come face-to-face, we'll have to come through a webinar. So yes, Linda, the answer is yes. I'm not sure if you guys listened to the governor briefing today, but according to the notes that I received and what I read is that I think they are planning to reopen some of the things effective May 1st. And I'm not sure if reopening is the right word, but I believe they are looking to do a few things different beginning May 1st. Any questions from the public? Anybody that call in that is not a board member? Or comments?
Just letting you know that Firelands is still doing what we need to do, and thanks for all your support.
This is Melanie. I would like to also thank you all for all your hard work, Firelands and Mircha and your team, and we're available if you need help delivering supplies. Let us know.
Okay, if there, thank you, team, and Melanie. Melanie, I'll give you a call tomorrow morning. If you guys don't have any other questions or comments, we will take a motion to adjourn. Again, in the meantime, if you think tomorrow that you have questions, always call us, email us. We will be available. I'm hoping by the end of this month to have something scheduled as committee or board meetings. If things get somehow back to normal, we will keep our original dates. And if we can't meet face-to-face, we'll meet via a webinar. Robin, can you please read the last motion?
To adjourn the April 16th, 2020 teleconference webinar meeting of the Mental Health and Recovery Services Board of Seneca, Sandusky, and Wyandotte Counties.
This is Celinda. I'll motion.
This is Dean. I'll second it.
Roll call, please.
Dean?
Yes.
Pat?
Yes.
Marcus?
Yes.
Dee?
Yes.
Pamela?
Yes.
Tony?
Yes.
Luke?
Yes, ma'am.
Celinda?
Yes.
Karen?
Yes.
And Ruth?
Yes.
Thank you.
I want to remind everybody that the next regular in-person scheduled meeting for April 30th, 2020 is canceled. We will send another notification to the media and the public. I will consult with the board chairperson and we might call a meeting via webinar or in person, or we'll let you know again what will happen in May. The meeting adjourned at 8:20 p.m. If you guys would like to have a webinar dinner, as we usually do, feel free to get your lunch or dinner, and put it in front of you and we can have dinner together.